Hi, and welcome to Well as Well, where we explore alternative and complementary medicine. And today we're sitting with Dr. Tyme Gigliotti, an experienced acupuncturist with Source Point Health in Maryland. And he's been in practice for about 27 years. And he's going to share with us today what a typical acupuncture session looks like and how long it typically takes to see results for a lot of conditions. And then also some of the common misconceptions that folks that are seeking acupuncture might have. Go ahead, Dr. Time. Thank you for being with us.
Well, thank you. Yeah, so what's unique about an acupuncture session is it begins with an intake, and most acupuncturists will deliver a treatment on that first day. And in the intake, we'll get a sense of what's happening with the patient. So the patient will have an opportunity to express what's happening in their own words, and not only the details of what's happening, but also their experience of
Mhm.
what's happening, because that's also important. There's not just their back pain, but how does it interfere with their life? How does it affect their life? What does it keep them from doing that's really important to them? So we get a sense of, what their life is about, what's important to them. And this also helps us to set goals. So, we're not getting a goal like a certain number here, right? It's like, oh, I want to be able to garden more, play softball, or a better golf swing. So we'll spend about anywhere, depending on the person, 10 to maybe even 30 minutes chatting about the details of what's going on. We also cover what's happening with their body systems. We ask about sleep. We ask about their appetite and digestion. We ask about elimination, menstrual cycle if they have one, um, any medications that they're taking, any other treatments that they've tried, what's worked, what hasn't worked, all the details about what's going on in their life. And that again takes about 15, mine usually lasts about like 30 minutes of conversation. And then I explain briefly about what we're going to do. I tell them about the needles and what is involved in the diagnosis and treatment and what that looks like. Uh, Generally, we treat on a massage table that's covered with a sheet and table paper and a pillow. And so, what I'll do is I'll then have them uh, go up on the table, or I might run them, since my specialty is orthopedics, I might have them do some orthopedic tests very gently to test to see their flexibility, strength, maybe what's going on with certain muscles and joints, right? Watch them move. And I also do a posture assessment, right? How their head lines up. Is their shoulders straight? I look at their hips. I look at their feet and knees. And then we get them up on the table. And then we'll look at their tongue. So I'll have them stick their tongue out, right? Like that. And that gives us a lot of information about what's going on inside their body, right? I look at the body color, the coating, if there's cracks, things like that. And then I do what's called feeling or reading the pulse. So we'll put our fingers on the brachial artery on the wrist, sort of like right here.
Mhm.
And there's a different pulse position for each of the different organ systems. So heart pulse, lung pulse, liver pulse, and so forth. And there's 12 of those. And so I feel the surface of the waveform of the pulse and its shape, how it feels. Is it strong? Is it weak? Is it thin? Is it full? And also how it feels in response to a little bit of pressure at the different levels. That gives us enormous amount of information about what's going on with the patient. And depending on the nature of what's going on with the patient, will determine how much time I spend on the pulse. If it's pretty cut and dried, it's pretty simple, situation, then I'll probably spend about 5 minutes on the pulse. If it's a more chronic condition, maybe an internal organ issue, maybe a complicated issue, maybe they have like an autoimmune disorder, I might spend as much as 20 minutes reading the pulse. Um, and then we'll follow up with a few more questions, and then we'll begin a treatment. And so I'll explain that, we use these hair fine needles. They're a fifth of a millimeter wide. They're super thin. Um, and they're meant to just slide through the fibers of the skin. And I tell people you should feel it and then not feel it. And then generally what people feel, it's a variety. Some people don't feel anything. Like they may not feel like, oh, is the needle in? I don't notice it there. Sometimes people feel like a brief like a pinch sensation, but it's very mild. Or you might feel what I call a zing, because I don't really have much a better word for it, where people feel something like briefly moving, and it's very mild. It's not intense. These are sort of like on a scale of 1 to 10. These are like on a 0 to 3 intensity, where you might feel something moving, or like a pulse or a gripping sensation, or like a muscle twitch, or maybe like a electrical, very gentle electrical sensation moving from the area. Sometimes people feel a very brief dull ache, but again, I tell people you should feel it and then not feel it. So generally, people feel it for like a second to a few seconds, and then they don't really feel anything. And so some points, I'll treat these, with these hair fine wires. I'll treat different acupuncture points. Um, I generally, I learned from a more minimalist school, so we generally don't use a lot of needles. I might use anywhere from 2 to 10. Certain Japanese traditions use a lot more, but they put them in very shallowly. I put them in maybe anywhere from 2 millimeters under the skin to sometimes an inch. And people might go, "Whoa, an inch? That's whoa!"
It
But
sounds like a lot.
it sounds like a lot, right? But if you think about like your arm muscle or your shoulder muscle, I mean, you've got 3 inches of muscle there, right? So
Mhm.
it's really no big deal. And as I tell my students, because I teach this also, depth of insertion does not equal sensation, right? A lot of times you'll feel the superficial ones more than the deep ones. So as an orthopedic specialist, I treat a lot of muscles. So I might go up to an inch into the muscle, and then either just gently manipulate it, like twirl it with my fingers. I don't know if you can see me do that,
Mhm.
to get a very gentle sort of radiating sensation. It might feel like warmth, or like a very, very dull minor ache for just a moment, or like a sense of something moving along a line. And that is to stimulate this movement of energy, which we now know as electricity, that like moves through what's called the fascia, or the different tissues of the body, to affect a particular change.
Mhm.
So needles sometimes are just in and out. I might put one in, take it right out, put it in the sharps container, right, where they're recycled and disposed of. Some, more often than not, especially these days, because everybody's a little bit more stimulated, shall we say, or high strung, or that
Sure.
we have high paced life, a lot of obligations. So, like just this earlier today, like I actually treat a physical therapist. She was in earlier today, and I treat her for like neck tension and migraines. And so I put in about 6 needles, very shallow, a couple like a little bit into maybe a half an inch into the muscles. And she's also the mother of two and homeschooled, and she's very busy and physical therapist. And so she just like, I left her with the needles in, I turned off the lights. Sometimes people like a little bit of light music, or the sound machine with the waves, or birds chirping, something nature sounds, right? And they'll lay there for about 15 to 30 minutes. Um, Generally, after about 10 to 15 minutes, I always go in and check in, see how they're doing, make sure they're comfortable. Acupuncturists these days usually have like a little wireless doorbell chime, or a bell. So if somebody moves or something, and it maybe a needle gets aggravated and it gets a little achy, they ring the bell. We come right in, we fix
Mhm.
it. But I left her in there for about 30 minutes. I checked in 15 minutes. I went in. She was completely passed out, snoring. Went in 15 minutes later, felt her pulses very gently, because this is all about trying to be gentle and comforting.
Mhm.
And so she kind of came to, and she was like, "Wow, like at first, like for the first couple of minutes, my mind was really busy, because her mind is really busy."
Mhm.
And then all of a sudden, she just sort of nodded off into this twilight state, and then she fell asleep. And when she came to, like for a moment, she kind of forgot where she was, because that's how. But she's like, "Oh, I feel both relaxed and really rejuvenated at the same
Mhm.
time. Like I just got like this really satisfying nap." And so that's pretty common. Some people, I might guide them in a breathing exercise or meditation, that might take, just anywhere from like a minute to several minutes. Some people like to pray. So, we'll have them do that, some kind of prayer ritual that is helpful for their spirit. Whatever, this is sort of like, strokes for folks, whatever
Mhm.
people want to do. But I'm happy to guide them in a meditation or a breathing exercise, or they can just focus on just their breath and just relax and let themselves just go. So, a treatment could be anywhere. So the intake could be anywhere from 15 to 30 minutes. And then the exam is another anywhere from 5 to 15 minutes, depending on what's going on, including pulse taking. And then the treatment will last anywhere from like generally like 15 to 30 minutes is common. For me, most of my treatments go for about 45 minutes because I get a lot. I mean, I've been around for a while, so I get a lot of complicated folks. So
Mhm.
there's generally like phase one treatment, 15, 20 minutes, maybe 30 minutes, and then a phase two treatment, which might last another 15 or 20 minutes. And then as someone who specializes in orthopedics, I'll often combine what's called some soft tissue work, which is like a pin and stretch. Like I might put my finger here and then just have them move, or I'll put my hand on their elbow and then we'll kind of stretch this way to help their carpal tunnel.
Mhm.
Or I might put my hands on their back and they just gently move this way, or their hips. And so that type of soft tissue work takes just like 2 to 5 minutes. And then, we help people kind of collect their things, and then we meet outside and we pay and reschedule. A lot of people have insurance, so I take insurance. A lot of acupuncturists these days have insurance. Maryland is great for insurance coverage. And then I would say, a lot of people come in with misconceptions about what acupuncture is going to be. One is that it's going to hurt. That's the biggest one. That it's going
Right.
to be scary, right? That like, oh, I can't sit still for like 15 minutes. There's
Mhm.
no way. And then everyone's just like,
Can we go again?
yeah, like,
Can we
do I
do
have to
this?
get up? Like, just give me the keys and I'll just slack up. Right?
That's right.
So, yeah, so that's a common misconception, or that there's going to be chanting and rattles, waving, and wands. And one patient said, "What kind of pagan are you?" And like,
Really?
I'm not a pagan. They're like, well, don't you have? I'm like, no. Or they walk in, like they haven't seen me, they've never met me, and they walk in and like, you're not Chinese. I'm like, I'm not.
Thought I was.
They lied to me.
That's
No, so
right.
that's a common misconception, is that I'm Asian. Although with a name like Tyme Gigliotti, I don't know how they might confuse that.
Right.
But or that they're surprised that I had to go to school and get a degree. That's another common misconception. Or that they think it's going to hurt. They think it's going to be like, or they think they're going to be covered with needles all over the place, and it's not really like that. We're pretty spare with our use of needles. And
Right.
or that it won't work, or you have to believe in it. That's another thing. I'm like, well, it's not a religion, it's a science, so you don't have to believe in it, but you can. um, and so oftentimes they're very surprised that they leave feeling better than when they came in. I have to say, it's rare. It's rare that somebody doesn't leave with some significant percentage of improvement uh, when they leave than when they came in. And a
Now,
normal, yeah,
if I may interject, do you
yeah,
find this result also with those that come in very skeptical of it? Or,
yes,
oh, you still see the same results?
absolutely,
Wonderful. See,
absolutely,
that's great because a lot of
yeah,
times you would think that the mind could just kind of control the body and this isn't going to work. So we're not going to let it work.
yeah. Well, I would love that, but if my mind could control my body, then I'd never have back pain,
Right.
and and I'd be able to eat all the cheese burritos I want.
Hmm.
But unfortunately, the mind isn't that strong. No, it does help. I think people do generally respond better if they have a more positive attitude. But I think that that's only because they spend less time in resistance. Animals, I was also trained on animals, and animals get better really fast
Hmm.
because they don't have the same psychological, hoo-ha going on between their ears that people do.
Hmm.
And most of us, unfortunately, and I'm included in this, like I learned this in my early days of getting treatment, is I did not realize how much energy I put into resisting life being the way it is. And that consumes an enormous amount of energy or chi.
Absolutely.
And so I think that's the only difference, really, is that skeptical people are probably like, they're sort of like hypercritical of their situation. So they're kind of like over analyzing. But honestly, it still works just as well. I have people come in who are like actively, like, I don't believe in any of this. I'm here because my wife, wants you to fix me, and I'm like, I'm not into this at all. I'm like, no problem, no problem. So I generally don't talk a lot. I listen a little bit. I do my thing. I don't make a lot of hoo ha about it. I treat them, and they're like, oh wow, that's yeah, well, that's probably not going to last though. But it's fun to watch that when that happens when people are surprised. And then I would say, healing the body, whether it's a digestive issue, a menstrual issue, or like what I treat generally, orthopedic issues, arthritis, and things like that. It is a process, right? You cut yourself, the skin will heal, the wound will heal, but there's different stages to that. It takes a certain amount of time,
Mhm.
no matter how much I, send my love to my thumb, it still takes some time to heal.
Mhm.
And a lot of it is really getting people out of an old bad habit. And when I say habit, I don't mean things that people are consciously doing themselves. We're used to being in a certain posture. We're used to eating a certain way. We're used to getting a certain amount of rest, usually too little. Um, we're used to going through life with a certain attitude, and that creates a certain sort of energetic posture, an energetic sort of comportment way of being. And acupuncture kind of like sort of breaks us out of that habit in a very gentle, natural way that works in sync with the body. So it really just helps the body to heal itself, and it helps us to become more aware of what's going on inside us and going on around us. So it leads us to make better decisions about what we eat, how much we rest, how much and what type of exercise we get or activity. And so, if someone comes in with like a severe complaint, I'd like to see them twice a week. I mean, because once a week, I have them 1 hour. And, usually the first visit will last an hour to an hour and a half, and follow ups are about 45 to 60 minutes. Um, because in the follow-ups there's less talking, maybe five
Mhm.
15 minutes, unless they're really going through something emotionally, we spend a little bit more time. But you know I only get them 45 to 75 minutes a week,
Mhm.
uh, if they're just coming in once, and then they're going out and doing life in the normal habitual way, which might be behaving in ways that aren't really helpful for their well-being. They might over exercise, they might overdo it, because a lot of times we live by concept. I should be able to do this, or I should do that, or I shouldn't do this. And so they're not really tuning into their body. So
Mhm.
treatments in the beginning, once to twice a week for about 4 to 6 weeks, is generally the first course of treatment. It helps people to become more aware of how they're feeling and to tune in to what their body needs, very much like being on a bicycle. If you're on a bicycle and you're losing balance, like let's say I'm losing balance to the right, my brain doesn't go, oh, I need to shift 8.7 pounds 15 degrees to the left and speed up 3.2 miles per hour. My brain doesn't do that. It just goes, oh, lean left, like
Right.
slow down.
Yeah.
And it's like, it's a very visceral thing. So in Chinese medicine, what is interesting, in Asian medicine, this is your brain. This helps to process sensory data, but your mind is in your body. Like when you go to a restaurant and you're thinking about what you want to eat, if you factor out like your budget, or what you've been craving, if you really just tune into your body. And kids are actually really good at this. They say, oh, I want an almond joy or a Snickers bar. But if you get past that, if you really leave them to their own devices, eventually they stop eating candy and they start eating real food. It's really about tuning into what's the subtle senses I'm having. And when you begin to apply that in a conscious way as you move through life, um, you're not fighting against this bad habit. And so then after like the first 4 to 6 to 8 weeks, maybe, um, depending on what they're coming in for, then the body is starting to able to hold the benefits of the treatments longer, and they're not doing things to sort of not harm themselves, but they're not doing things to slow the process of healing and recovery, right? They're not getting in their own way as much. And then after that, then we start to see them maybe like once every 2 weeks, once a month, and then maybe once every couple months. And then after that, I tell people, like, call me when you need me, because they're able to kind of fix themselves, like, oh, I'm getting more rest, I'm drinking more water, I'm doing more of these exercises, I'm not lifting this much weight, or they're doing more of what helps them and doing less of what gets in the way of their well-being.
Hmm.
And then I say, come in, either call me when you need me, or come in like once a season for like a little tune-up, to kind of help the body get a little reminder of like, oh yeah, this is how to function properly.
Okay. So, are there any things that you personally recommend that somebody who's received an acupuncture treatment that they don't do for a day or two?
Mm-hmm. Well, I would say be mindful of what makes your symptoms worse and don't do those. Now, having said that, that's not always easier. That's not always, people can't always do that, especially if they have a physical job. So I would say we work on um, the mechanics of what they do. So by and large, you can kind of do whatever you want. Like if people like to do yoga or go to the gym, great, do yoga, go to the gym, unless there's certain movements or postures or exercises that really make you feel poorly. Then I would say, okay, let's baby this. This is not forever, not forever. We're just going to take a little bit of time off from that. Uh, then we'll be able to get back to it. We just have to baby this a little bit, let it heal,
Mhm.
so we're not going to mess it up. Um, but by and large, I would recommend also, like, people don't, like, after the day after a treatment, I would say that night don't take any like hot soaking baths or long showers. Wait about 12 hours, and I would say don't go out and get drunk because some people see me on a Friday evening, like, okay, yeah, one, two drinks, okay, fine.
Mhm.
But after that, like, maybe take it a little bit easier.
No
Um,
benders.
yeah, yeah, like, maybe stop at two. Um, and then I would say also, like, just be mindful of, you know, your mood, and just remind your body is such a great barometer of what's happening, right? If you're tense, if you're tight, if you're feeling things speed up really fast, that means you're not at ease, right? So it starts with the breath. It starts with recognizing that my body is tense, that my
Mhm.
gut is, maybe I'm clenching my belly and my diaphragm, and
Your
or maybe
shoulders
I'm
are
hunching my
elevated.
shoulders, right?
Yeah.
Or I'm furrowing my brow, and like that's an indicator. Oh, right, stop. And I tell people, just get a little looser and a little softer. Change your posture. If you're down, get up. If you're up, get down. Change your breathing, and just take a note and just acknowledge that you're feeling what you're feeling. Give yourself permission to feel it, whether it's pain or discomfort or a mood.
Mhm.
Um, and so, if you're doing that, you don't really have to refrain from a lot after a treatment.
Okay. And during we're in your 27 years of experience, what kind of a time frame have you seen for conditions to be resolved? And I know that there's a
Mm-hmm.
wide range of things
Yeah,
that you've treated, so I'm sure
yeah,
that those
yeah,
times are they're varied.
yeah. So there's sort of like the standard answer, and then there's the we're often very surprised answer, right? Because there's some people that, like, I remember this one woman, she brought in her grandmother who was 93, and she had severe back pain. And I thought, oh man, I feel her pulses. She's very deficient. She's very frail. 93, good spirits, sharp as a tack.
Hmm.
Um, and I was like, oh man, she's got like this like list of symptoms, like 2 pages long, and she's on all these meds. And like, man, I don't know. I did like 3 or 4 treatments on her, and her sciatica was completely gone. Like, and then she called me, like, I just don't want to come in for treatment anymore because I just don't need you. And then, like, 2 years later, you're 95. 2 years later, my back's starting to ache a little bit. I did like
Wow.
one treatment and she was fine. So, having said that, um, I would say people should start feeling better right after a treatment, like within that day. Sometimes people feel it, they don't feel the effects until the morning after.
Hmm.
But by and large, within that first day, you should notice some noticeable difference. And I would say a normal course of treatment for a regular sort of standard orthopedic issue, generally like 8 to 12 treatments. Once or twice a week for about 4 weeks, and then maybe once a week for another 4 weeks. And then if they're doing what I ask them to do, and if they're listening to their body, more often than not, then maybe we might do a few more, like once a month, once every few months, to kind of keep this momentum going. Obviously, if people are in a like more severe situation, uh, like that involve multiple organ systems that are chronic, have lasted years and years, it may take 20, 30 treatments. And people are like, oh, 20, 30 treatments. I'm like, well, okay, you get a course of medication, you're going to be taking at least 20, 30 pills. I mean, I have I have a friend who's now taking blood pressure medicine, and he's 60. He's a year older than I am, and he's on it for the rest of his life. Or no one goes, oh, Doc, I have to take this for the rest of my
Right.
life. No one, you mean every day
Yeah.
for right? So, you know, I said, well, 30 treatments. I mean, that sounds like a lot, but honestly, we can get 30 treatments in like 6 months. So
Right.
okay, if you're going to be alive for another 40 years, 6 months is not so bad. Yeah,
Well, and
because
in some
again, we're
cases,
helping the body heal itself. Yeah.
right. In some cases, especially with chronic issues, I mean, how long did it take the body to get to where it was when they finally come and see
Yes.
you?
Yeah. I mean, I have people that like have had migraines for 10 years. I'm like, how do you live? And they're so tough. But medications help them a little. And again, I'm not against Western medicine. I refer to Western
It has its
medicine
place.
practitioners all the time. My dad was a dentist. My mom was an OR nurse. Like I grew up looking at medical stuff since I
Hmm.
could read. But I think it's really just about managing expectations because people are used to taking a pill and having something affect them where they don't really have to think about it. And Asian medicine, the glory of it is on the front end, you have to spend some time cultivating some mindfulness. But then, after a couple months, like you're not expending any energy being mindful any more than you think about how to walk across the room and stay upright. I mean,
Hmm.
how many of us walk, unless you have some injury or neurological condition, you don't have to think about how to drive, how to walk, how to eat. You just naturally know how to do it.
Hmm.
And it just sort of becomes ingrained and embodied. So I tell people, like, just give it some time. We're going to spend a little more effort on the front end, much less effort on the back end. And honestly, when people come in to see me, like just this other day, I was seeing a woman for the first time. She's 24, and we were talking about her condition, and I'm thinking about what's life going to be like for her 40 years from now. We don't think, I mean, when I was 24, I didn't think about that. So this is about how to create a foundation of wellness and mindfulness that's going to
Hmm.
last for the rest of your life and will take almost no effort after, like, say, 3 to 6 months.
Yeah. Small investment for a long reward, isn't it?
Yes, yes.
Well, thank you so much for sharing all of that, unpacking that for us, and kind of giving us a visual of what, we can expect if we were to come in for a treatment. And I love listening to these stories, and these misconceptions were pretty humorous.
Yeah.
So, but thank you again, and just it's such a pleasure to have you on.
Likewise. Thank you.
All right, take good care.